It's my pleasure to introduce this next talk. Don and I are going to have a conversation about just communicating with your medical providers, really picking up and lifting. I think Londy's keynote address was a perfect transition into this. Now Donna is joining me. Thank you, Donna. Go ahead and have a seat. Donna Hollister is a certified urology nurse and has been at Munson Medical Center from 1994 to the present. She has served as program chair, vice president, and president in the local Great Lakes Chapter Society of Urological Nurses and Associates. Donna also started the US2 Traverse City, Michigan chapter in 1993 and continues to lead a support group to this day. Donna has been married to Ron, her husband, and a prostate cancer patient and survivor for 50 years. So good for you, Donna. Yes. Thank you. We're going to have our discussion now. They should be on. So Donna, like we said, we're going to talk today about your experience really as a urology care nurse for so long. Also, you've been leading a support group for how long has it been?
31 years. 31
years for prostate cancer patients. And then why don't you also, tell us, I don't know if any of you saw on social media, we used a little video clip of Donna to promote this retreat, and we were like, come listen, come meet Donna and other caregivers like her. And so you shared in that clip a little bit about your experience, but do you want to share also then about your husband's, that transition?
Sure.
And this is one reason I wanted Donna to speak today, because it's just such a unique experience of having worked in urology for so long, really, talking to patients, talking to caregivers, and then becoming a caregiver herself. So can you talk a little bit about that, Donna?
Yes, I can. I started the support group in 1993, and my husband always helped me with it. So he was working with me side by side, with the support group, getting it going, working at special events, doing, senior events where we would talk to the community about prostate cancer and everything that was there. So when, in 2019, he went for his physical, and they talk about high PSAs. He didn't have a high PSA. His PSA was 2.7. which most doctors would say is normal, but I kept records, being in the medical field, and his last PSA was 1.2, so I thought, well, you need to see the urologist. So I made an appointment for him. I didn't wait for him to make the appointment. He got in there, and the doctor, Ron and the doctor came over and talked to me afterwards and said, everything is fine, but I feel a little bump on his prostate. And I said, okay, so when are we going to do the biopsy? And Ron says, we'll get it done soon, So at that point, they scheduled a biopsy. And I was also working part-time, not in just the urology office, but also as the GU or genitourinary nurse navigator at the cancer center. And so I got all the reports before the doctors did. And so I received Ron's cancer diagnosis before the doctor did, so you can better believe I was on the phone with the doctor saying, hey, did you see his report? She said, no. I said, well, this is what it showed. She says, well, let's meet in the office this week. So we made an appointment and went in. From there, we just, did our MRIs. He did another targeted biopsy, and our journey began from there.
Thank you, Donna. In your experience as a urology nurse, what advice do you have for caregivers and patients to feel comfortable asking questions of their healthcare team?
Well, you should never be afraid to ask a question, and listening to everybody talk today, especially the caregivers, even Jeff last night, the presenters today, you need to talk with your partner, whether it's your husband, significant other, whatever, your father, grandfather. You need to talk with them. And then you need to make sure you do go to those appointments with your loved one. It's important. You need to write down questions beforehand. And I know today in the medical field, you have the option of when you get a diagnosis or something, you can go into a patient portal. Can show of hands, how many people use the patient portals? Okay, and it's very helpful. But sometimes when you first get that information, it's scary and you don't understand it. So you can go ahead and do a little research ahead of time, write down questions, and then take that to the visit with you. But make sure you and your loved one have discussed ahead of time, you know, what you're looking for, what questions you have, and even some of your expectations, because expectations are different for the caregiver than what they are sometimes for the patient. And so I think one of the main things you need to realize is that when you're sitting in there with the doctor, with your provider, and he's telling you about the cancer and what the treatments are, you need to make sure that you feel comfortable asking questions. As they say, the only dumb question is the one that's not asked.
Thank you. And I want to reiterate that, and I think, again, like Londi talked about, you know, she's like, I've got lots of questions, and her dad did not have the answers, but she's like, I will get those answers. So that resonates, I think. What are some effective communication strategies either you've seen caregivers use or that you've used to ensure loved ones' needs and preferences are understood by their healthcare providers?
Again, that's a lot of open communication, and that's, I totally agreed with Dick and Jan when they were up here talking about, and she was talking about her experiences of going into the appointments with Dick, and she would not only write down questions, but she would write down answers. And then they would discuss them afterwards. And they may have had two different answers for the same question. But that's a very important point, that you need to understand where the next person is at. You need to understand what your loved one is looking for and what you're looking for. As far as, I guess, talking with each other, making sure that, I guess it's just the understanding, you know, the open communication, writing it down, looking at other resources, going to resources like Zero, introducing, you know, finding out where support groups are, and getting the information even from other people that have already walked in your shoes. And that's one of the things we advocate in our support group, you know, they're self-help groups. And so you want to make sure that you're talking with people who understand where you're at. Nobody is going to tell you what to do, but they're going to at least share some experiences with you to maybe help you make that that decision, or to help you understand your questions a little bit better, or to help you formulate a list of questions that you need to talk to your provider with.
Thank you, Donna. And I do just want to give a plug to we at Zero on our website. We've got several, we have a series called Questions to Ask Your Doctor, and then we also, Sherry mentioned, there's an Ask the Doctor series as well. So those focus from screening and genetic, I think there's like family history and risk, with the Ask the Doctor, and then questions for your doctor we've got for newly diagnosed, for advanced prostate cancer patients. We've got questions to ask about clinical trials, chemotherapy, hormone therapy. So check those out. Those can be a good resource to look at ahead of time, so you are prepared to ask those questions with your provider.
Yeah, and with that, don't always go to Dr. Google. He's not very efficient.
Yes. Trusted sources, yes,
Right,
yes.
trusted sources.
Just Google could lead you down the wrong rabbit hole, yeah. What challenges or barriers have you seen that are most commonly faced by caregivers when advocating for their loved one's care?
I think some of the barriers are, number one, if your loved one isn't being forthright with you and letting him know exactly what, you know, the issues are, and maybe you haven't been able to attend some of the meetings. But some of the barriers come from the healthcare provider too, so you have to be comfortable with your healthcare provider. There are personalities, and sometimes the personalities don't click, and maybe you need to look at a different healthcare provider. It's okay to ask for a second opinion. If a provider doesn't want to give you a second opinion, there's something wrong with the provider, because everybody's entitled to a second opinion. So barriers can, come in all forms. It can come from the patient themselves, or it can come from the healthcare provider side of it. But as a healthcare provider, I think everybody deserves to know what's going on. I do a lot of patient education, and I have been sitting in meetings with patients and their loved ones about they've chosen a particular treatment, but they haven't had the option to look at other treatment options. And I will actually go up and grab the provider and bring him downstairs and say, this patient is not ready for, say, surgery. They need to talk with radiation oncology. They need to talk with oncology. They have more questions. And I've been able to postpone treatments that really weren't what the patient wanted. So you really have to be able to get past the sometimes biases of the provider. And I respect all the medical field, but urologists are surgeons, radiation oncology is radiation, oncology is chemotherapy and the medical end of it. So you kind of have to get together to work as a team. And that's really what you're looking for. The big barrier is not knowing who your team is. You need to be really clear on who your team is and who the leaders of the team are. And basically, the leaders of the team should be you and your loved one.
Thank you, Donna. I love that, because I just want to echo that. We at Zero, we emphasize, get a second opinion, feel comfortable with your providers, and Donna's exactly right. If something's not right, or you don't feel like you're being heard, either the patient or the caregiver, then it might be time to look for another provider who you trust and feel like is listening to you and understands your needs and desires as a patient. So, how do you maintain a positive and respectful relationship with your loved one while advocating for their best interests, especially when there may be disagreements or difficult decisions to make?
That can be really tough, and you've probably all been there. But it is ultimately the patient's choice. And with my husband and I working in a urology office, when he got his diagnosis, he said, well, of course I'm going to have surgery. And I said, wait a minute. You haven't heard the whole story. Well, I've talked to the guys in the support group. I said, yes, but you haven't heard the whole story. So I actually had the doctor give him a referral to radiation oncology and oncology, because I wanted him to hear all the treatments that are available to him. And I basically ended it with, honey, whatever treatment you decide, I'm going to support you. If you choose radiation, even though I work in a surgical office, that's perfectly fine. That's your choice. I'm going to support you through it. So I think the main thing is, again, is that open communication and, supporting them and letting them know that you support whatever decision they make. It's a difficult time for them. They're looking at, when you hear cancer, patients hear it as a death sentence. The C word, that's the end of life. I got to start making plans. And as we know today, prostate cancer is a very curable, and there's longevity with the diagnosis of prostate cancer. And so a lot of it is just reassuring them, offering them the support that they need, and helping to direct them where they need to go.
And I think we all wish we had a Donna at our medical providers, right? Yeah, but I think a tip maybe could be, we all know you've been to the doctor, you've got maybe 15 minutes. Mm-hmm. And they're not going to be able to answer all of the questions in those 15 minutes maybe. But so I think getting to know the nurses is really important at your healthcare provider office too. So you can ask them questions and kind of have that that lifeline of being able to ask the questions that you need and feel like you're getting listened to.
Yeah, and the thing with a doctor's office is, everybody's busy. Everybody's shorthanded. I know we get so tired of hearing it, but that's, I think, the way of life today. But a lot of times, your first hand to the doctor is through their nurses, or through that particular doctor's nurse. If you can communicate with them through the portal or a message system, whatever works for your office, they're going to get the message to the doctor. And if the nurse is talking to the doctor, and I know in our practice, and I am guilty of it, I will talk to the doctor and say, this family has a lot of questions, and so the doctor will set up a time, usually at the end of the day, like a last appointment of the day, 4 o'clock, and they'll spend 1-2 hours with the patient, because they want to make sure that everything that he's talked about, you understand. They want to make sure that you and your loved one understand what the situation is, what the recommendations are for treatment, and to make sure that you understand the side effects of everything and that all of your questions are answered. So I would highly advocate for anyone that if you have questions that are unanswered, you need to get to that provider and set up another appointment to sit down and spend some time with that provider and talk with them. You can utilize, if you have a cancer center with a nurse navigator, or a lot of the offices now have nurse navigators, that's your pathway, that's your communication tool to get to the doctor.
Yeah, that's a great tip. Thank you, Donna. So utilize the nurses, utilize the navigators. Sometimes they're called caseworkers, maybe, social workers. Those are all can be members of your healthcare team and can really help connect you not only to answers, but also resources, financial resources, emotional resources, support resources that you may need. So how can healthcare providers better involve and support caregivers in the decision-making process and care plan for their loved ones?
Well, that's pretty much like what we've been talking about, Jeremy, is that the provider also needs to include the caregiver. There are some situations where the provider doesn't want anybody else in the room except the patient, and that's not acceptable in almost any situation where a loved one goes to an office, whether it's cancer, heart disease, diabetes, anything. The person that is going to be taking care of your loved one, which is you, needs to be there and find out exactly what's going on. What was the other part of that question?
It's okay. How can healthcare providers better involve and support caregivers in the decision-making process and care plan? Okay,
and so in our office, I make sure that the doctors know about the ZERO support group system in our group in the Traverse City area. I make sure they pass out our cards and our information to everybody that is diagnosed with prostate cancer. And it doesn't matter if it's someone, they'll tell someone, oh, it's a stage 1, and you're going to be on active surveillance, and we're just going to follow this. But those patients also need guidance. Down the road, what if? So what if my cancer advances or anything? And so we need to make sure that the providers, and especially in our office, that they understand that there's a support group network. And so we have things posted in the office for ZERO. We have our information on flyers that we hand out to every prostate cancer patient. And we have the information available to anybody who's interested in looking at it. There's a lot of valuable information, and I'm very fortunate in the state of Michigan. We have an organization called MUSIC, and it's the Michigan Urological Surgery. It's a collaborative effort, and every urologist in the state of Michigan is a part of it. What they do is, and they started out with prostate cancer as their main focus, and that was how, that was when the robot was first coming into play. And
the surgical
robot, yes. And so we were not fortunate to have a robot in northern Michigan, so we were having to send people to, other areas to have surgery done. And so through MUSIC, all the urologists in the state would get together and talk about, you know, the outcomes, the benefits, side effects, complications, and what they wanted to do to make things better. And so we also share with our patients, because we're in Michigan, we give them the music website, because they also list support groups. They list doctors in the area, the different expertises that doctors have, whether it be on active surveillance specialists or advanced cancer specialists. But they come up with programs, or not programs, but guidelines for treating the different areas of prostate cancer. So I guess in Michigan, I'm fortunate that we have this available to us as well to offer to our patients. But we always direct everybody to ZERO, because ZERO has the best websites, the best information, and we want to make sure that our providers are giving the patients everything they need.
Great, thank you, Donna. What advice would you give to someone who is new to the caregiving role and may feel overwhelmed or unsure about how to advocate effectively?
That was a big change for me. Wearing the hat as the nurse and then as a support group leader, and all of a sudden now I'm a caregiver. I guess it's a scary time. And when you're on the other side of the fence, so to speak, it's like everything you've learned or thought about just kind of goes by the wayside. And so it's okay to have, you know, some fear. It's okay to feel a little overwhelmed. But then you need to, again, communicate. You need to start looking at what's available and what you can do. Caregivers are very special people. And sometimes it's hard to, like Landy was saying, not take care of yourself. And pretty soon you start putting your thoughts and fears and everything aside, because you want to focus on just one person, the loved one that has the cancer. But you also have to focus on you and what you need from this diagnosis and the path that you're going to go down. So that's when you start asking the questions. That's when you start, I'm going to say, insisting that you participate in your partner's care. And you start learning a little bit more about what prostate cancer is. It's changed over the years. I've been in urology over 50 years. And when I started in urology, most of the patients that I saw died from prostate cancer, because we didn't have PSAs, we didn't have a lot of different things, you know, and most of the time it was that wonderful digital rectal exam, and the doctor would say, oh, you got a rock hard prostate, sorry, there's nothing we can do for you. There was no treatments until the advent of the PSA. And so it's like things have changed a lot over the years with prostate cancer. Advocacy has improved. Caregivers are given the recognition, and I think we need to feel empowered as a caregiver, that we have obligations and rights as far as working with our loved one to get the end results of all the questions answered that we need.
I love that. Thank you, Donna. Now we wanted to see if, are you ready? Are you able to take some audience questions?
I can take some questions.
Okay. Shelby, can you grab you can use this even if you want. Oh, yeah. Does anybody have any questions for Donna?
Can we join your care group with Zoom?
Mm-hmm. I'm sorry, say that again?
Your support group, can we join that with our listening with Zoom?
Yes, we do. Our group, of course, being in northern Michigan, you know, we have our winter months and our wonderful spring and summer months. And so we usually meet in an indoor facility from, say, September through April, May, depending on the weather, and we do offer Zoom. In the summer months, we meet in the beautiful botanical gardens of our old state hospital grounds, and we don't have Zoom at those meetings. But most of the time, we do have Zoom, and if anybody's interested, I can give you the information. Well, all I would need is an email address, and you would receive an invite to the monthly Zoom meetings.
And I will say, too, we have many other support groups that are,
Zoom.
some are hybrid, they'll do both, but many are virtual only and meet regularly, so if that's an option. But you probably want Donna's expertise, probably, aren't you?
And we offer, we have a lot of people that come in. We have doctors that come in, dietitians. We have someone from the YMCA that's offering a special program that developed for cancer patients that's starting at our local YMCA in Traverse City. And so we try to keep people informed about everything that's going on and not just talk about and, kind of overkill, just prostate cancer. We also want to talk about healthy living because there are other things. Heart disease is the #1 killer. Somebody with prostate cancer may not die from prostate cancer, they may die from heart disease. So we need to make sure everybody is informed about every aspect of their life.
Thanks, Donna. Hey, I'm from Michigan. How do you spell the music organization and what's the website?
The music, I think it's music.org,
It's MUSIC.
music.org.
Thanks.
And they have a variety of videos. They've incorporated now not just prostate cancer, we also do, they call rocks, so kidney stones, and we also do kidney cancer through the music organization. But they have videos for prostate cancer on surgery, radiation, oncology, all different things and different areas that you can ask questions.
I have a question about the nurse navigator role and how does that work with insurance? So one of the challenges I've faced is getting through to the doctor's office, but then having tests denied by insurance and navigating that process to make sure that my loved one gets the care needed in a timely fashion.
Okay, so do you have a nurse navigator where you're at?
Newly now, so initially when all the tests were occurring to understand what stage my husband is dealing with, it was a lot of back and forth, not only between that office, but insurance and also the labs that were canceling tests because the approval process was taking much longer than I think there's an urgency you feel when you find out a diagnosis, and they don't seem to have the same urgency.
Yeah. Nurse navigators are great. I mean, that's part of the whole program, and a lot of them are employed through cancer centers, and they look at everything. I know I work really close with my nurse navigator over at the Cowell Center since she took over my job, what she does is she goes through all the reports and everything, and then we discuss patients on a tumor board. So that's an open board of all the disciplines. So you've got doctors, nurses, so you have the urologist, radiation oncologist, nurse navigator. There's like 4 or 5 different people that are involved in it. But we also look at, and the nurse navigator's role is, if you have questions about certain things, to get you directed to where you need to be. So does it need to be with social work, or does it need to be with the financial navigators? Most of these cancer centers and hospitals offer financial navigators, and those are the ones that are going to look for avenues to help with financial needs. And Triage Cancer will be here later today, and they'll be talking a little bit about that as well. But there are people within the system that should be able to help and direct you. But a lot of the financial navigators that I know also have access to all of the funds that are available to help cover expenses. So I think the nurse navigator role is a great way to go because they have the avenue to get you to where you need to go. And if you're not getting there, just push it a little harder because you need to be able to get the answers.
I'd like to add a comment about second opinions. I'm a firm believer in second opinions. I've had several of them throughout my treatment course. One thing that you might consider is that you occasionally need to get out of your current network to get a second opinion. A lot of times if you stay in the same network or the same office with a different doctor trying to get a second opinion, they will just simply reiterate what your first doctor said because they don't like to offend each other or step on each other's toes. So I have, in all cases, gone outside of network or away from that initial office to get a second opinion so that I know I have fresh eyes looking on it and there isn't going to be any contest between providers in terms of the information that they supply.
And that's very true. In fact, when you do ask for a second opinion, I mean, if you're in a local, like we're rural in Traverse City, but most of our second opinions go out to the University of Michigan, downstate, might go to, you know, any place else that the patient wants to go to. But that's up to you as the patient and your support person, your caregiver. You know, if you're interested in a second opinion, you definitely need to ask for it, and I would definitely get one, not in the same practice. And I totally agree with the just reiterating the same thing over again because you don't want to step on toes. The best thing to do is get out of that situation or out of that office and into another office. And you may go to a second opinion and they'll say, well, this is what we recommend. It's pretty much what your doctor in your office recommended. And they might say, we can do your treatment here, but you can get the same treatment where you're at. That gives you the option of saying, I want to do it here or I want to do it there. But second opinions are definitely very important.
I didn't see any other questions.
No, I think we're good, which that's fine. We, thank you, Donna, so much for sharing your experience both as a nurse, support group leader, and caregiver with us. It's really helpful. Thank you so much.
Well, I'll tell you, it's been a journey. I actually started at Munson in 1974, so there's 50 years there. I'm semi-retired, but as a nurse, you never retire as a nurse. So I go back and I help, and I do a lot of education. I maintain my support group because I said I will never retire from my support group. And when I travel and I go away for the winter, I still zoom in on the support group meetings. It's just very important for me to do. And I appreciate ZERO for all that they offer. And I appreciate all of you for being here today. I'm really hoping that in the future, we're going to fill 2 of these rooms with caregivers. So I hope that all of you today, when you go home and you go back to your support groups, you let them know what ZERO Caregiver, is all about. And hopefully we can bring more people back. And I think just the information that ZERO is gathering from everybody here today, it's going to be bigger and better in the future. And so I want to thank Jeremy and everybody who put this program on. And I look forward to seeing everybody in the future again at more caregiver meetings.
Thank you, Donna.